Hello, back again with another video today, and we're going to be talking about CPR. I'm going to talk about how to perform CPR. One note, though, is that there are more in-depth and detailed descriptions and better ways of doing this, like in demonstrations online and in the Scout book. So this is not the end-all, be-all for CPR. So what is CPR and what does it stand for? So it CPR is when a person like passes out and they are unconscious, and you need to pump their heart manually for them until you can get help. And then so it means cardiopulmonary resuscitation, and so that means like has to do with like the heart and pulmonary resuscitation, trying to like bring them back. And yeah. So you use CPR, like I said before, when someone's unconscious, but you need to make sure that they're not sleeping. So you like, as I'll get into later, you make sure that they're actually like passed out and that they're not breathing. And this is the moment when you actually use CPR. So here are the steps to begin CPR. I got these from the Red Cross website, which I think is a good resource. They're also in the Scout book as well, and they may vary a little bit. So the first step is really just check the scene. And once you approach the scene, you want to make sure it's safe, because you don't want to put yourself in danger in order to rescue someone else, because in the end, both of you may not actually be saved, which would be really bad. So make sure the scene is safe. Then this is what I was talking about before. You want to make sure the person is actually unconscious and not breathing. And so you tap them on the shoulder and then like try to shake them maybe a little bit. If you know their name, you can call their name, or like it says here, you can shout a little bit. Make sure like it'll be loud enough for them if they were sleeping to wake them up. So then that way you know for sure that person's actually passed out. And yeah. So then once you've actually made sure they've actually passed out, you want to check if they're breathing or not before you actually call 911. So the way you do this is you look down at their chest, right? And you look kind of like, if they're on the ground, for example, you want to get closer to the ground and look at their chest to see if it's rising or falling. You can also put your hand over their mouth and feel if like air is coming out or not. So that way you know for sure they are not they're not like breathing. And then this is when you need to actually check for CPR. And then you can also do a pulse to see if they have a pulse or not. So then this is the point where you've concluded that they have like they're not breathing, but they still have a pulse, which means they're still alive, but they're like slow. It's not going to be alive for long. So this is when you call 911, because the best case scenario is that a trained EMT gets on the scene and can do CPR themselves or take that person to a hospital. But most of the times that's not really the case. So if a lot of times you don't have to yourself call 911 unless you are by yourself. So this is why you should ask a bystander to call 911. And then you can also send someone to get an AED, which is an automatic external defibrillator, which is like in the movies when they say clear and they rub like the two parts together. And then so what this is you use it together with CPR, and it just, as I'll talk about later, it kind of helps to like get the heart started again. And yeah, and then in some cases there may not be an AED, which is okay. You just begin traditional CPR. So you want to open their airway. So you make sure they're lying on their back, and then you tilt the head back and slightly lift the chin. So this way the airway will not be blocked or anything. It'll be completely open. And then you can, then that's like one of the steps of making sure you can start. So the next step is to check for breathing. Like I already said, you should have probably already done that before you call 911, because you want to make sure that they're actually like not breathing and just asleep before you call 911. So listen carefully, like I said, for sounds of breathing, and you can feel for their breath, and then like check their chest to see if it's rising or not. So what you're gonna do is you're gonna put your hands on top of each other. For example, you can do right over left, left over right, doesn't matter. But what you would do is put your right hand over your left hand and interlock the fingers around it, but your left hand is still like flat out, and then you interlock them and then hold them tight. So you kind of have this like web shape with your right hand or left hand, depending on the one, like clinging to the palm of your left or right hand. And so what you're going to do is you're going to use this to administer compressions. So you're going to put it uh put it on their chest, and then you want to make sure that you kind of lock your elbows, and then you use your body weight to kind of to administer those compressions. And you want to make sure they're 2 inches deep, because the heart is actually like protected by the rib cage and stuff. So you want to make sure you're actually reaching the heart and helping it pump itself. And you want to do 100 compressions per minute, or as many people say, like the song Staying Alive, like dun 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 dun. So like kind of like that in a way. And that way you'll it's an easy way to remember how many compressions you need to do. Then after what the ratio is, we usually do 30 compressions to 2 rescue breaths. So when you do the rescue breaths, you want to make sure the person's head is tilted back, and then you chin lifted, and you pinch the nose shut. Then you place your mouth over their mouth and blow into it. Nowadays, there's actually mouth protectors. So if you have one, you can wear it. If not, you can just blow on their mouth. So, and you want to make sure that makes a complete seal, because you want to try to inflate their lungs. And yeah, and then so you do the 2 rescue breaths. Then you want to continue compressions. Throughout this entire process, you want to make sure you're actually going fast, because every minute they're losing like lots of brain cells without oxygen. So you want to, and also you can't just let their heart like not be beating, because you are the source that's making their heart beat currently. So you're going to keep continuing and cycling through these steps, and until the person is alive, like so as they start breathing again. Or if an AED becomes available, you can keep trying it. Although AEDs do not always work all the time, so you want to just keep using it with in conjunction with the CPR, or the help arrives, medical help arrives, and you want them to take over because they're trained better. But there are actually other things that you need to keep in mind. So continue CPR steps until you become super exhausted and can't have anyone take over. So then at that point, if you become so exhausted that you might pass out yourself, you need to stop and you can't keep going. And it's okay if you have like a trio of people that maybe like switch, right? That'd be honestly that most ideal situation. And also another thing is, let's say for example it's like a fire, and the fire is creeping towards you guys. That's the moment when you need to stop, because you don't want to put yourself into a position with so much danger to the point where you are not going to really be able to help that person and save them, and you instead are putting yourself at risk and not really being able to save them, which is not good. And we already talked about the proper form of CPR and the ratio of breaths to compressions, which is 2 to 30. And the AED, automatic external defibrillator, and it's used in combination with CPR, because what you do is there's the AEDs are built with very easy to read instructions on the outside. And what you do is they have these not two stickers, but like multiple pads that you put on in different areas of the body. It shows you exactly where. And you do it, and then there's this automated voice that tells you and gives you instructions, and then it will say administering shock, like stand clear. So that's the moment when you don't want to be touching that person. And the idea is that you can do this, like, I'm pretty sure it's kind of after you do your rescue breaths, or like every so often. And the idea is if you can get their heart to get jump started again, and then they can start like breathing again, and then it'll help with that. And again, things to keep in mind is just that, like, keep in mind of your safety and like your actual condition as well, because I feel like some people sometimes are so focused on saving the other person that in some cases they end up becoming another victim, and they begin passing out because of exhaustion. So that's a very important thing you need to consider while you're performing CPR. Thank you guys for watching. If you guys, like always, have any questions or want have video requests, please put it in the comments. Thank you.